All right, let's just jump right into it, because what we're talking about today is a pretty huge deal in the world of weight loss medication. A brand new pill just got the thumbs up from the FDA, and believe me, it completely changes the game.
And this, quote, this is really the whole story in one sentence. Now you've probably heard of GLP-1s, that super powerful class of drugs. But the key here is just how simple this is. No more needles, no more fasting, no more waiting around. I mean, this single sentence captures a massive, massive breakthrough.
So here's the official news. On April 1st, 2026, the FDA gave the green light to a drug called Orphaglipron. You'll see it sold under the brand name Foundeo. And what makes it so special is that it is the very first GLP-1 pill that has zero, and I mean zero, food or timing restrictions.
And it's not just about convenience. This thing really works. In its main clinical trial, ATTAIN-1, patients on the highest dose lost an average of 11.2% of their body weight over 72 weeks. And look, that is a seriously meaningful result that can have a huge impact on someone's health.
Now you might be sitting there thinking, hang on, this sounds kind of familiar. And you're not wrong. We do already have oral GLP-1s out there, like Rybelsus. So what's the big deal? What makes this one so different? Well, the answer is actually some pretty fascinating chemistry. You see, the older pills are what's called peptide-based. Think of them as tiny little pieces of protein. The problem is, your stomach's #1 job is to break down and destroy protein. So when you swallow one of these older pills, your gut just goes to town on it, and only about 1% of the actual drug makes it into your bloodstream. Just 1%.
And to get around that 1% problem, the older pills demand this really strict and, frankly, super inconvenient ritual. You have to take it on a totally empty stomach with just a tiny sip of water, no more than 4 ounces, and then you have to wait another 30 minutes before you can eat or drink anything else. It's a lot to ask for a daily pill. And this is where it all comes together. Orphaglipron is what we call a small molecule drug. It's just not built from amino acids, so your gut enzymes pretty much leave it alone. It resists that whole breakdown process, which means you can take it with your coffee, with your breakfast, whatever, no rules. This isn't just a small step up, it's a completely different kind of technology.
So the chemistry is different, we get that. But does that actually lead to better results? That's the million-dollar question, right? Well, let's look at the data from the trial where they put these two pills head-to-head.
In a trial called ACHIEVE-3, which looked at patients with type 2 diabetes, the results were pretty darn clear. People on Orphaglipron lost 8.2% of their body weight. On oral semaglutide, it was 5.3%. That's almost a 3 percentage point difference, and in the clinical world, that is a big, big deal.
And if we dig into the numbers a little more, you can see it right here. Not only was the weight loss way better, but Orphaglipron was also better at controlling blood sugar, a bigger drop in HbA1c. So on both of the trial's main goals, the new pill came out on top.
Okay, but efficacy is only half the story, right? With any new drug, we have to talk about the fine print. What about the side effects? What can people actually expect?
Now, if you've been following these drugs at all, this list won't surprise you one bit. These gastrointestinal issues, the nausea, the vomiting, all of it, are kind of the known price of admission for this entire class of medication. It's usually worst when you're first starting out or when you bump up your dose.
But let's be real, these side effects aren't trivial. In the trials, about 10% of people, so 1 in 10, taking Orphaglipron actually had to stop taking it because they just couldn't tolerate the side effects. It's a real consideration, and it really drives home how important it is to start on a low dose and go up slowly with your doctor.
And of course, we have to talk about the black box warning. This is the most serious alert the FDA puts on a drug label, and it's on all GLP-1s, this new one included. So what's the deal here? What does this actually mean for people?
So, here's the crucial context. This warning comes from studies done on rodents, which happen to have a lot more of the specific cell receptors for this drug on their thyroids than humans do. As of today, there's no solid evidence that shows an increased risk of this rare type of thyroid cancer in humans. The warning is really there as an important precaution for a very, very small group of people, those with a personal or family history of specific conditions called MTC or MN2. Okay, so we've covered the science and the safety, but for most people, this all comes down to the practical stuff. Can I get it? And more importantly, can I afford it?
And this number, honestly, this is the part that might be the most shocking. With the savings card from the manufacturer, the cost for a lot of patients could be as low as $25 a month. Even the cash price for the starting dose is expected to be around $149.
I mean, just look at this comparison. When you put Foundayo up against the leading injectables, which can easily run you over $1,000 a month without great insurance, the difference is it's night and day. This is a huge shift in making these drugs more affordable.
And that's really why this is such a big story. It's not just about cool chemistry or even the price tag. It's about access. This pill removes two of the biggest real-world hurdles that stop people from even trying these amazing therapies: a fear of needles and a busy lifestyle that just can't handle a complicated dosing schedule.
You know, this quote just nails it. The injections might give you slightly more weight loss at the absolute peak in a clinical trial, but what good is that if you don't take it? The best medication in the world is the one you actually use consistently. The sheer simplicity of this pill could mean better real-world results for millions of people.
So that really leaves us with the big final question. When it comes to treatment, what's more important? The absolute maximum power you can get from a drug, or the everyday convenience that makes sure you can stick with it day in and day out? With this new pill, that's a conversation millions more people are now going to be able to have with their doctor.